We love to show lips, and we certainly love to show the great AAFE exclusive right angle technique. It is absolutely fantastic. And also syringe stretching technique. What does that mean? That means that we took we'll take a number of dermal fillers, and we will, using sterile technique, backfill ComfortTox syringes, which are the best syringes on the market for neurotoxin delivery and also filler delivery, especially when you're doing lips like this, and especially using the right angle technique. Now, when will we use the right angle technique? When we are looking for great precision, number one, in delivering filler or multiple fillers, even in the same lip enhancement, to either increase the vertical height, to get more lip show, or also to do projection, or a mix of the two. And that's really what we're doing right here. So you can see the patient is very comfortable. We've put some ComfortTox BLT ahead of time, and it sat there for about 15 minutes. The best topical anesthetic that we use for facial aesthetic injections, whether it's neurotoxin or fillers or PDO threads here. And the point of this, and you can already see this start to develop, she's using a medium filler backfilled into a number of ComfortTox syringes, and we are delivering this in a fairly superficial plane, medium to superficial plane. Now, it's so important to know the anatomy, and that anatomy includes the depth of the vasculature, because that's important. You don't want to be going ahead compressing or occluding any of the vasculature. So here we know that we are superficial, and above it we know how deep the vasculature is in these lips here, and we are staying right above it, and that's why she's able to go in and come all the way out. But the other things to realize, and again, depending on what you're going for, here it's a mix of some projection and some vertical lip height, and you can see it developing really beautifully. The other things to consider is, what is the depth of injection? Are you going to inject right at the vermilion border, in front of it, behind it? All of those nuances make a huge difference here when it comes to developing the kind of lips that you and the patient have really agreed on. So that is really what's important. And you can see this patient pretty much has not stopped talking all through this, and that's a really good indication of how comfortable they are. You also see a Band-Aid up in the cheek area, and that is from in the same appointment doing some lifting PDO threads, the V-Soft Lift PDO threads, which are the best ones. So this area has been pulled up. The oral commissure, the nasolabial fold, has been pulled up already. And when it comes to combination treatment and combination treatment appointments, it's important. We typically will want to do lifting PDO threads first, which will pull back, redrape the skin, lift the skin, lift the whole area, and that will also turn up the corners of the mouth, the oral commissure. Then you can go ahead and do your lip enhancements. Then at the same appointment, if you want, if it's not directly in the same area, you can go ahead and add some dermal fillers. Certainly neurotoxin is not a problem because that's going to be in a completely different area. Now let's go to the lower lip, where we are going to use some of the same principles. Take a look at that upper lip, by the way. In this case, in this patient, you see no bruising at all. She's got great definition of the vermilion border on the upper lip, and now we're just going to go step by step. You need to know how many millimeters apart is each injection, and again, that's going to vary depending on the filler. That's going to vary depending on what we are trying to accomplish. How do you know how to do all that? You need great AAFE certification training, whether it's our level 1, just straight volumization. If this is a more advanced technique that we start to use in level 2, level 3, our master lips courses. But let me just say something about lips in general. Lips is so important to building a great aesthetic practice. No matter if you are a dentist, physician, nurse practitioner, physician assistant, no matter what, you've got to get good at lips, and you got to start somewhere. And starting with volumization, straight volumization in our level 1 techniques is great for most lips, and that's really going to be enough for many patients. But so many patients at this point, specifically millennial patients, as they're starting to come in, the first thing they come in for is lips. And if you want to grow a long-term practice, be able to deliver some great lips. And the AAFE has so many different techniques, and certainly you've been watching one of them throughout this entire thing. And you can see here, a little bit more superficial on the lower lip because we want a little bit more lip show than actual projection, because that lower lip already naturally did have some good volume already. So here you can see really just some great techniques from the AAFE. We have the best faculty, the best training, and so many different techniques to give patients exactly what they want. And what you want is a successful practice. So it's time for you to get AAFE certification trained today.